was diagnosed in August 4, 2008 at the UCSF ALS clinic by Dr. Lomater. And then in September 3, same year, the diagnosis was confirmed by Dr. Sorensen at the Mayo Clinic in Minnesota.
I see. Yes. And then how long prior to the diagnosis were you feeling the symptoms?
About November 2007. I started feeling left hand weakness. And they thought at first it was multifocal motor neuropathy. So I was on IVIG for 4 months.
What is that exactly?
It's intravenous immunoglobulin infusions to suppress your immune system. And that's a rule-out test or treatment for ALS or multifocal motor neuropathy.
Oh.
If you respond, you have the autoimmune disease. If you don't, you have ALS.
Oh, I see. I see.
Because the symptoms are very similar.
And then when you discovered that you had ALS, and what was your response, and your family's response, and your husband's response?
Well, we were basically all crying, and that ended my career as a nurse.
Right.
Because I basically could not function as a floor nurse anymore, and the fatigue was already catching up with me, and my walking was difficult, and so it was a big adjustment. So for 2 months it was what you would call a dark period, where we were just sad. We didn't know what to do. There were so many things to learn and so many things to adjust to. And then I attended the ALS support group meeting in October, and things got a little bit better. I met people who have the same disease. I've never met anybody with ALS before that, so and then it was trying to stay ahead of everything. The first one was the BiPAP AVAPs, which I started using in August. They told me to start using it because it takes time to adjust to it, and it was a difficult adjustment.
How long would you say it took for you to feel comfortable?
I say about 2 months.
Wow.
But I would use it during the day and try and use it at night for longer periods each time. Until finally in around October, November, I was using it throughout the night, and I still do it. I use it throughout the night today.
And it looks like you have other respiratory equipments, for
example.
I
do. I have the cough assist and the suction machine because the cough is getting very weak. And that's what... And I've been using it. It's been very useful during this allergy season.
So this is helping you with the management of the secretions.
Yes.
Would you say the copiousness of the secretion, the characteristics of the fluid itself has changed?
I call it the thick phase. Because it is definitely thicker, even though I have enough fluid intake, or even extra. And it's just harder to clear. So the cough assist, it brings it all out, and I feel so much better afterwards.
And then help with the suction to clear that secretion out of your mouth.
Yes.
Right. Like you were telling me about the text-to-speech.
Yes, text-to-speech, because as you can hear, my speech is interesting. Feels like I had lidocaine in my mouth. And I'm using today Proloco to go with my iPhone, and it works well. I can use it to talk with people on my phone and also people near me.
So there are times when you like to give yourself a rest in terms of speaking, or your diaphragm gets a little more fatigued, that you rather have a text-to-speech kind of take over a little bit of communication. I also use it Proloco on my computer when I need to call my husband. Is that Proloco is the name of the software that you use on your Apple?
Yeah, I use it on my Apple, and it's really helpful because if I change the voice, he really comes right away. It's also best to find somebody or a dealer or home care equipment supplier who is forward thinking.
Yes, yes.
And who is familiar with your condition.
With ALS.
Yes.
Yeah, that's very important. Okay, so Kristina, my last question is, what do you want people out there to know about ALS, and what's on your mind?
Well, on my mind mainly is the concern for the everyday care of ALS patients, because we emphasize the looking for a cure, but we all miss the part where the ALS patients need help now. It's a very expensive disease because of all the equipment that we need and the home care that we need, and insurance doesn't cover a lot of these things. So not only is it hard for the patient, but also for their family and friends. That's all.
All right. Okay, well, thank you very much, Kristina.
You're welcome.
Thank you.